Hi, this is Avi Ratnanason. I'm the host of the Patient Experience Channel and the CEO of NHS. And I'm here at the Beryl Institute Conference in Dallas, Texas. And I'm here with Julie and Tom, who are both from the Edward Elmhurst healthcare system or facility in Chicago. And they've done a fantastic job presenting today on their secrets of success at their institution on improving patient experience. So Julie, do you want to tell us about this great coaching model that you have to improve patient experience where you are?
Sure. So my name is Julie Danker. I'm the Director of Patient Experience at Edward Elmhurst Health. And one of the initiatives that we have really focused on was really trying to provide our employees and providers with a tool to help them connect with patients. We created a tool, and it's a communication standard called GREAT, and it stands for Greet, Relate, Explain, Ask, and Thank. And the concept behind it is for our employees to make it very authentic. It is not guiding them as to what to say or what to do, but really a framework how they can better communicate with patients.
This has been a very effective tool. Tom, do you want to take us through the details of how GREAT works?
Sure. I'll give you an example. So G is greet. You walk into the room, you basically say hello to everybody, shake their hand, let them know who you are, what your role is. R is relate. So before we get right into the medical aspects, we want to remember to find something in common, sports team, the weather, and then as we're getting into the medical part, we want to listen really well, which is a form of relating, really connecting to the patient.
And the next letter?
Okay, then we're at explain. So I want to be really careful. I look at my main job as really bridging knowledge and experience that I have to what they can understand and say in lay terms if they have no medical background themselves. What's going on? Why am I thinking this? What's going to happen in the next 5 minutes or hour or 24 hours? So they really have less fear, less anxiety about their situation.
Yeah, and you're the medical director where you are.
I am.
And you teach your physicians to implement this coaching tool.
We do. I mean, many of them are great already, but we can all use reminders and examples and get better, actually.
And how do they do with the A part, which is ask?
Okay, so A is ask.
Yeah.
Oftentimes I'll conclude with, now tell me, after we've gone through things, are there any other concerns? And you'd be surprised how often a patient brings something up that we didn't talk about that was quite relevant.
Right.
It's a level of compassion that you can add. So it's that, changing from the 1 foot out the door to really sitting down, having eye contact with your patient, asking them open-ended questions, making sure that they're involved and engaged in the plan of care as well. So
this is after you've done the explanation, you do a check back and do the ask.
We do. That's essentially the ask, yes.
And the final one is T.
T is thank. So, really thank them sincerely for trusting you, for using your system. And I think that is a nice way to close this interaction.
And what is the result since you've used the GREAT coaching model in your hospitals and healthcare system? What effects have you found?
It's been very contagious. We've seen so much excitement from providers to frontline staff who've really embraced this and really have just created it and made it authentic, made it their own. Because again, we're not offering scripting. We're asking staff to take this and really just make it feel very natural for them. So it's essentially is a framework that you can use in any situation and any discussion. It could be a very good encounter. It may be with someone who's being really difficult, and we just need to figure out what's going on that's creating some of these anxieties. So it can really just be used and molded into any situation, and that's really the brilliance behind the concept.
And Tom, where do people go for more information if they want to know more about the GREAT? Yeah.
So we prepared it for everybody around the world, and we hope it makes it to Australia.
Yeah.
You can find it on our website, which is www.eehealth.org/great.
Okay, fantastic. You guys will be able to download it. It's a free tool. These guys
Right.
have made it available. It has been a success, and anyone can use it in any hospital.
And also there is an email address attached, so if you have questions, reach out to us. We're happy to help you. We would love to help you implement it into your organization.
Fantastic. Thanks very much, guys.
Thank
Thanks,
you.
Avi.
Thank you. Cheers, guys. See you. Bye.
Bye.